Hi, my name is Madison Prager. I'm a Bethel College nursing student, and the topic of my presentation today is evidence-based practice change to implement sports-related concussion treatment. The PICOT question I used was, in sports-related concussion injuries, do athletes who use head-neck cooling devices recover faster compared to those who do not use head-neck cooling devices? The background of this was concussions occur very frequently in contact sports, but there hasn't been an established regimen to help treat those athletes that experience this type of head trauma. Current practices right now just include rest and pain relievers to alleviate symptoms, but there aren't legitimate protocols that have been established to treat concussions. As stated by McLeod in the literature, recommendations for rest are broad and not specific to individual patients. An initial period of moderate physical and cognitive rest, for example, limited physical activity and light mental activity, may improve outcomes during the acute post-injury phase. Head-neck cooling devices do have the potential to be utilized as a treatment for sports-related concussion injuries. Concussions do have the potential to cause long-term psychological effects if it's severe enough or if it's not treated appropriately. An effective treatment plan needs to be established in order to help decrease recovery time and reduce chances of brain damage for those athletes in the future. In the literature review, high brain temperatures have caused damage within the brain, so decreasing these temperatures quickly is going to help prevent any further damage on the brain. Also stated within the literature, Gard said, providing immediate treatment of a head neck cooling device has the potential to be an option for managing a sports-related concussion, but needs to be addressed in a larger study. Also stated by Jackson in the literature, sophisticated studies to evaluate the head neck surface cooling induce changes in regional brain perfusion patterns and functional connectivity are also warranted. Within some of the studies that have been done previously, many athletes have been able to go back safely and faster than those who were not using the head neck cooling treatments. From the data in the literature review, head neck cooling devices can be an optimal treatment option, but there still needs to be an abundant amount of studies before that can be established as a legitimate treatment plan at this time. The CUSIN competency used was evidence-based practice. Utilizing this type of CUSIN is essential to ensure it is an appropriate treatment option to establish for the patient. Evidence-based practice is going to help determine if head neck cooling devices are effective on concussion treatment before it ends up being used in current practice. This is going to allow for continuous improvement within healthcare and allow for nurses to maximize their practice through updated clinical practice. As stated by Youngblood and Bruton in the literature, evidence-based practice also provides opportunities for nursing care to be more individualized, more effective, streamlined, and dynamic, and to maximize effects of clinical judgment. In conclusion, head neck cooling devices have the potential to be used as a treatment plan for concussions. This tool is very simple to use, and it doesn't take a lot of teaching for those wanting to use this as a treatment plan. Nurses are going to be able to provide better care to their patients with this type of head injury rather than just trying to alleviate the symptoms. Care plans for concussions are very bleak. So utilizing this type of tool is going to allow for nurses to have better nursing care plans for this type of treatment. Now, some recommendations would be to have more studies done to be able to determine if this type of treatment is effective enough as a treatment option for sports-related concussions. Implementing this as a standard is not attainable right now, but based off of some of the literature review, it shows that it can become a standard of practice within healthcare. Treatment options right now are very low, and legitimate treatment plans need to be established in order to properly care for these types of patients, because right now it's just a symptom alleviation and it's not really true care to the patient rather than just minimizing symptoms for now. They're not exactly addressing what is wrong with the patient. A possible recommendation would be to do a study across multiple different types of contact sports and to see if there is improvement on the recovery time of patients as well as long-term effects. And then also it would be important to see if there's a difference between each sport and their athletes. So maybe one sport could potentially have better outcomes than others, and just to see what those differences are. Thank you.